when it came out here in my head it was very scary because you were not just having headaches, but it was just an electrifying kind of pain.
Because it hides in the nervous system, di ba,
Yes.
Dr. Shalante?
So I didn't know that, and I was in my 40s then, and a dermatologist then gave me what I have to do. I can't remember it right now, but you would be able to share. But I had to isolate myself at home. I couldn't go to work for 2 weeks. But more than that, I was so scared because I thought I would get blind. I mean, seriously, because I started to Google, right? When I was sick. So I started to Google, I started to research, and then doon ko nakita that a side effect could be blindness and paralysis.
Which was part of Dr. Shalante's presentation.
Yeah.
But again, you didn't have a conversation. You went to Google.
No, the doctor also
Also,
told me.
it was part of
the
the conversation.
Yeah, the dermatologist. Remember, the first person I went to was a doctor.
That's good.
That's the first. That's the first. The first person I called was a doctor. I mean, number one, being a journalist, it would be quite shameful if I didn't go to a doctor first. So the first thing, I went to a doctor. But the point is, after going to a doctor, is you read a lot after.
More research.
Absolutely, you research, right? I mean, it's part of being a journalist. So I got really scared because if it happened to other people, I felt it can happen to me. So that's the first time.
How long after?
After that, so that was in my 40s, maybe 10 years after, I was in a trip. And I suddenly got parang mga butlig in my stomach. So I thought, baka it's an allergy, you know, maybe it's too cold, anything. Then what I did was I took a photo, I sent it to my dermatologist. And the dermatologist told me, Karen, I think I have to see you. It could be shingles again. Again. So this was a little milder, but then I remember taking an antiviral medication. So after that, that's when I got really alarmed. Because yes, I mean, I don't smoke. Fine, I mean, lack sleep. I lack sleep. But relatively, I would consider myself healthy. But I've had an autoimmune disorder. I told Dr. Solante and Doctora when I interviewed them, is I did have hyperthyroid when I was much younger. And that, when you treat your thyroid, it becomes an autoimmune disease. Yes. So the reason I came out and I wanted to share is I don't think Filipinos know how dangerous shingles is. I don't think many people know. The first time I had it, I was so ashamed because when you read it, you think it's related to sex.
Really? Because of the word herpes.
Exactly.
Because of the word herpes,
Yeah,
yeah.
in the beginning, right? So,
But even singaw is herpes, by the way.
yes,
So you know.
that's
yeah.
trivia, right? So I think that's why I want to share my experience. It's because I really think Filipinos, especially at a certain age, I think I got it much earlier in my 40s, but I think that it's something you can't ignore.
Let's actually talk about it because also earlier I was saying they don't like to talk once you're at a certain age. What more? What is it you're going through? But again, thank you. Let's give Karen a round of applause for being brave and for taking it on to really spread awareness about it. So just before I go to Net about her experiences, I wonder, iba yung pain dito at here, hapdi pa rin? Or just to compare pain.
But you know, what was first painful for me was the one I got on my head. I think because it was severe, though, right? When I got it the next time, it was very small. I think it's because, in a way, I wasn't as tired, I was healthier, so maybe there was an attack, but it wasn't as severe.
But it did come back, that's the thing.
But I think the lesson is, it comes back. Case in point,
Net here has had it 3 times.
exactly.
Net, would you like to share? Thank you for that, Karen. Net.
Ang swerte ko lang talaga.
3 times.
The first time I had it was earlier than you. I was 36.
Oh, not even 40.
36.
Okay.
I had taken an early retirement, so I was out of a job, stressed, but I was fit. Thinner than now. So I was fit. I've never, like I said in the video, I've never had a serious illness. Tapos, when I was 36, in the middle of the night, nagising ako kasi parang may kamay na may thorns na biglang tumakma sa leg ko. Siyempre, unang isip ko, may mumu. Sabi ko, may multo ba ako? Kasi hindi ko talaga alam saan galing yung nagpabalik ko sa ako. Sabi ko,
Just came out of nowhere.
Out of
And
nowhere.
it woke you up.
It woke me up because it was so painful. It had occurred once that night, and then the following days, dumadalas. And then the pain would worsen.
So no physical reaction, it's pain.
There was a rash, but I did not see it kasi nandito sa likod ng knee ko.
Oh, okay.
So, buti na lang, may mga kaibigan akong doktor. Yes, I had mild rashes lang. May kaibigan akong doktor, tinanong ko sa Dok, may bone cancer na yata ako. Or sabi ko, may area na pumasok sa loob ng leg ko, kinakain from the inside. Sabi ko, Dok, ano to? Sabi niya, Net, puntahan kita. Tingnan ko kung ano yan. So, labas ako sa garahe, buti na lang malapit ng bahay niya. Pagpunta niya sa akin, from a distance, sabi ko, Dok, may napansin ako. May nakita akong 4 na dots dito sa likod ng leg ko. From a distance, tinignan niya, tapos dahan-dahan siya umaatras. Net, shingles yan. Ayaw niya lumapit sa akin.
Wow, that's a 36.
That was when I was 36.
Second.
Last 2021, when I turned 50, nag-recur. But this time it was my left breast naman yung sinasabi ko doon. But it was the exact same thing. Ayun na naman si thorny hand. Sabi ko, minumulto na naman ako, binalikan ako, dinakma yung left breast ko. Very, very fast, very quick. Naramdaman ko na to dati.
Okay. Was
And
it
then-
milder? No. Same
No,
intensity.
it was the same intensity. And
Okay.
sabi ko nga, I got very descriptive because my lashes would be very mild. I guess in that sense, I was lucky because I hardly noticed it until I realized na, okay, maghahanap ulit ako ng rashes kasi same pain eh. So the rashes were under my left breast. Hindi mo talaga, it's not as bad as the pictures that were shown by Dr. Salante. But the pain was the same and I got very descriptive because wala eh. COVID, it was during 2021, there was still COVID. So I had to consult a doctor. Siyempre, hindi ka naman pwede ipakita.
Teleconsult.
Teleconsult. So sabi niya, how do you know it's shingles? Doc, yun nga yung sinabi ko, yung parang blade na hinihiwa from the inside. Tapos there were times it was like there was a metal ball inside my breast na dinudurog from the inside yung laman ko. So yung mga sinabi kanina ni Doc Gio na it was worse than cancer. Sabi ko, oh my, kaya pala ganun. It would intensify. Minsan may mainit ang pakiramdam ko. There was a hot knife slowly slicing off my left breast. And there were times I would really put up my shirt just to check kung meron ba nangyayari.
Because that's the feeling, but there's no physical
no, it was all inside. Tapos, as the days go on, iba-ibang klase. Itak na nakatusok dyan, tagos hanggang likod.
Stabbing,
Tapos,
kayod.
stabbing.
Can you imagine these descriptive words happening inside your body or on a particular body part? Again, pain.
And I don't know if it's the same with Karen. Mahanginan, malamigan, mainitan, masakit.
Not yet. And it hasn't reached that. But go
Ako,
on.
it was like that. So, I would walk around the house, yung shirt ko nakagain.
Because you didn't like anything touching.
Nothing could touch it. Sudden movements would hurt. I couldn't go out of the house. I couldn't drive. I couldn't cook. I couldn't do, for 3 months, my life was on hold. And even the medication at the time that was given to me, ang effect naman nun, I was groggy all the time. I was
To sedate you from the pain.
because the pain is the kind that you don't squirm with pain. Ako, I would freeze. Talagang I would stop moving kasi kailangan dumaan yung pain. Hindi ako pwedeng gumalaw. And that was bad because it was making my muscles contract daw, doctor. Yun yung sabi sa akin ng doctor ko. So, the medicine that was given to me were anticonvulsants and anti-epileptic
It was that extreme.
meds. Plus, painkillers. So, dagdag pa yun on top of that. So, groggy all the time, bangag all the time.
Net from 36 years old to 50. Where's the third?
Oh, when I turned 51, and then
Oh.
when I turned 52. So technically 4 times, yeah. But the one last year, ang sabi sa akin, post-herpetic neuralgia na daw. Kasi wala na talagang rash. It was
It
just
was the
the
feeling
pain.
that
It was
stayed.
just the pain, yeah.
Wow, thank you. Again, Karen, Net, thank you for sharing that. It's not easy, I'm sure, as we saw, to talk about it. And we can only just try to imagine what the actual feeling is like.
But I wanted to tell you, with your reaction, it should be easy. Why wouldn't it be easy to talk about it? I mean, what's the big deal? You get sick, you get well, right? So I think it's also, we have to be careful with reactions on, it's not easy, oh, it's brave. Then it makes it more difficult to talk about it. It's a fact.
Thank you, Karen.
It's like if you get sick, right? And then you recover. That's it. It's nothing different from chicken pox, or you get the measles, or you
Fever.
get COVID,
Yeah.
which can kill you. The only difference with shingles is there's a lack of information about it.
And that's why we are talking about it. Thank you. Thank you very much for that, Karen. So, moving to the first doctor you go to, which you both went to, a dermatologist. You don't necessarily go first for infectious disease because it is a skin manifestation. Dr. Robredo, how can you tell? Because some will say, like, for dots, unless you really remember what it was like when you had chicken pox, not too big. But it didn't necessarily come out that way. So how do you tell? How can you tell?
Yeah, actually, that's right, Karen. A lot of my patients who have had shingles, they really come see us. Kasi nga rash siya. But during the interview, syempre we ask, when did it start? Usually, before the rashes appear, may pain na talaga.
So it's pain. It's
Yes,
a pain
burning,
factor.
pain, sharp, like everything that they said earlier. And then the rashes start to appear. First, red lang siya, like a normal rash. And then as it progresses, they turn into vesicles and blisters. But one thing that is very unusual kasi that makes it unique is it's only affecting one side of the body. And Dr. Solante
It's not
mentioned
all
earlier,
over.
no.
That's another
Meron
way
tayong
to
term na
diagnose.
tinatawag dermatome. So, sa body kasi natin, may mga levels yan eh, where the nerves sort of distribute. And it affects about 2 dermatomes only on one side of the body. So, pag andun yun, yung pain, sharp, burning, stinging sensation, rashes that turn into fluid-filled blisters and vesicles, affecting only one side of the body and not all. So yun yung characteristics na parang, okay, that's...
Dr. Dale, can you so if you're saying one side, it's literally half. It's
Kalahati
either the
lang.
right side or the left side of the sternum.
Yep, it doesn't cross over. So yun yung very, very unique characteristic ng shingles. And I was telling niya, kanina nagkakantuhan kami, I first experienced shingles, not me my dad. Dad ko yung
You
nagkaroon ng
diagnosed your
shingles.
dad?
Hindi, I was only 11, 12. And at that time, hindi namin alam kung ano siya. Kala namin, I don't know if you're from nabarang, nakulam or something, mga ganon. And I remember I was the one pa-cleaning the wounds, ganyan. And then after a few days, nagka-chicken pox na. Yeah, ganun siya, that's how it happened. And then my dad says,
I think that we should also demystify it, all right?
Yes.
Shingles is chicken pox.
It is. For
I mean,
older
that's the
adults.
point. It's not like an alien disease here, guys.
And
It's
most
technically
kids-
chicken pox. And then once you have chicken pox, so which most of the population gets, the virus lives in your body.
Reawaken.
When your immune system is down, then you get shingles.
Correct.
But technically, it looks like chicken pox.
Yeah, tama. Vesicular, erythematous or red base. Para siyang yun. May description
Yeah.
pa tayo ng Doc. di ba? Yung dewdrops on a rose petal. Di ba? Magandang pakinggan. Dewdrops on a rose petal. Kasi para talaga siyang red yung background niya, tapos yung mga tubig-tubig siya. Ganun yung itsura niya.
They mentioned medicines because there's no treatment. It's just to manage it though. So what were these managed? Because again, what Net said, anti-epilepsy, are those common? How do we rate when to give something like that to a patient?
Well, the treatment there is you have to give a drug that's also can penetrate the nerve and lower down the nerve pain.
Pain first. That's the first to be addressed.
Both of you were given, Karen and Ned, and the problem with that nerve pain reliever is that there's also a side effect on that. And the side effect, if you increase the dosage, that will really make you groggy, cannot sleep, and that's why we have to really tone down the dosage. So meaning the bottom line here is that those are temporizing treatment and will not really be the absolute and can cure the pain.
But again, best to go to a doctor because only a doctor will know that. I'm curious before I go back to Karen and Ned. Dr. Robredo, is there anything else that you can mistake shingles for?
Actually, quite a lot. Like Karen, a lot of my patients thought they were like rashes or allergic reactions to something. I remember encountering a patient nga. He has high pain tolerance kasi. But when he came to me, he had like the rashes of shingles on his back. Tapos sabi niya, Dok, kasi nagpamasahe ako eh. Feeling ko yung ginamit sa akin na oil. Parang gano'n. Ano daw siya, parang na-irritate siya, ganyan. Kasi usually like that. Kasi they appear like any normal rash. I mean, for an untrained eye, they all look the same.
But again, best to go to a doctor.
So normally ganun talaga yung parati. They never think about shingles. It's not a first in mind kind of thing. It's usually like it's either an allergic reaction, irritation. Yeah.
Now, going back to lifestyle, living. Beyond the pain, beyond the rash, how are relationships then? How are you dealing with it? Depression, of course, looking at yourself at the mirror, being isolated. What things come into play? Let's humanize this then.
Well, I don't want to be overly dramatic about it because I'm a career woman. So the first thing is I was really scared of how it would look if the rashes would go away. And I think what's depressing about it is because you don't feel well. It really hurts. But you have to remember it is temporary. It's not forever, right? It is a viral infection. And like all viruses, they go in their own time. So I think what's only depressing is the fact that, number one, if it's in your head or in your face, it affects how you look. Number two, the pain can get very depressing at that point in time. But I don't want to compare it to COVID because COVID can kill you. I mean, immediately, right, Doc? But I think it's a fact, well, you're isolated, you're in a room. Yeah, you're alone. But it's nothing like COVID. So I don't want to overly I mean, I don't want to dramatize the illness too much.
Okay.
Because you will get
Get
ill.
there.
It's a virus, right? It's not deadly, but it is painful.
How about the idea that you're putting your life on hold?
Well, my pain lasted for 3 months.
Oh.
So every year,
First is-
about
yeah.
3 months or more, give or take, a week. So everything's put on hold. I couldn't go out, like, especially during the time of COVID. Nung time na pwede na sanang lumabas, my friends were calling me, hindi ako pwede lumabas. Hindi ako pwede mag-drive. Kasi yung gamot ko naman, Doc, di ba tama? Nakakahilo, tapos ano siya eh, nakakabangag. Yun yung ano ko talaga.
So you can even have a conversation as much as you like.
I can, but I probably not remember what I said. And then pag nagdadrive ako, nag-try ako mag-drive, di ba? Nag-try ako mag-drive, na-distract ako, may nakita ko, may bagong bukas. Nakalimutan ko na nagdadrive ako. Dire-diretso ako. Buti na lang may COVID, wala pa masyado sa sakyan. Pero dire-diretso ako. Ako nakatingin ako doon sa tindahan. Tapos twice muntik nang masunog yung bahay kasi nagluluto ako. Tapos may naalala ko, ay may kukunin ako. Kasi nakalimutan ko na nagluluto ako. So, buti lang I have dogs. So, my dog started barking paglabas ko sa kusina.
But that's because of the medicine.
Yes,
It's not
exactly.
because of
That's
shingles.
not
That's what it is.
itself.
I mean, it's so, you have to be
Very
careful.
subjective, yeah.
This is
Subjective.
because of the medicine. Shingles won't do that to you.
Yes.
Okay.
The medication.
But it definitely, because of the pain, it limits all the movements.
Because
all
ideally you
activities.
should not be out.
Yes.
Right, Doc? Flat her.
And
Flatter.
it's not just about being out. You shouldn't have been cooking.
Yeah, it should
Even those things. That's why it really puts your life on hold. It puts it to a stop.
But it was COVID season, so who else would do that for me? So ako talaga because I had to isolate myself. Kasi I have my mom who's a senior citizen also, so hindi ko siya pwedeng i-expose din. So wala akong choice. I have to go out, I have to try and live a normal life. Pero hindi talaga pwede, hindi normal eh. So wala akong trabaho for 3 months. Sabi ko kay doktora, inaubos ko lahat ng savings ko for the 3 months. Ubos ang savings mo.
There's also the financial aspect. See how it affects lives. And again, it does depend on a case-to-case or a person basis. I'd like to address this one question then. Wait. Infectious ang shingles? Chickenpox is infectious, but what about shingles?
Okay, it is not infectious, no, because
It's not.
it's not infectious. Shingles is coming from the chickenpox. So once you have, like for example, if you have the shingles now, you just can't infect anybody near you or even the immunocompromised, because the reason for that is that it may be transmitted droplet, but it cannot survive much more in our mucosal because it's just a virus. No? But for anyone, so we have to correct that one misconception. If I have someone sitting beside me having shingles here, can I get shingles? No. Okay. You may be putting that person beside you in danger because you might have pneumonia or you might have other viral infection, and when that somebody has shingles, he may or she may get your infection also. So that's why we isolate them in the hospital if we can, if they are admitted, because we don't want somebody. There are other infections that they can acquire, and they can also get those in COVID. No? That's why we have to be
But then,
very
Doc, why was it that Doctora was actually cleaning her father
And then she
when
got chickenpox.
and she got chickenpox?
No.
I was about to jump on that too.
So most likely it's just a coincidence, but Doctora got that because she was exposed to chickenpox or varicella.
And she was 11 at the time because chickenpox is a childhood disease.
Yes.
So that's why 18 and above, it is diagnosed as shingles. Oh, wait, sorry, go ahead. Adult, no?
Even adults can get chickenpox. It's
I
the
said
same
chicken,
virus.
so it's not an
but-
age.
But you can't get shingles from someone who has shingles. If ever you get it, you manifest as chickenpox.
Chickenpox.
Yes.
Alright, so chickenpox
That's why-
nakakahawa, shingles hindi.
You can get chickenpox from shingles. So, kumbaga, like for example, if
You
Dr.
can't
Salat has
get shingles from shingles,
yes.
but you can get
Chickenpox from
shingles.
shingles.
Correct.
The manifestation. Okay. Thank you very much for clarifying that. And again, why you get isolated, it's advised. And any other advice? Obviously, don't scratch. Can you take a shower?
Yes, you can, but as much as possible, don't touch or scratch the lesion because it will really, the severe scarring can also cause deformity of the skin.
Okay. What if you've never had chickenpox? Can you get it?
Yeah, I think that's another misconception because
Like you'd be, I'm okay. I never had chickenpox.
the study or the data done was that there are also like 20 to 30% of those that have shingles will tell you, I don't have chickenpox. So there was this good surveillance in some of these countries. They did what we call antibody of the varicella titer. And so which means they have antibody, they have been exposed even if they don't have the varicella or the chickenpox. So there are potential high risk when they will be 50 years old and above that they can have reactivation of that antibody and they will be shingles, they will have shingles.
So it never. So the scenario is it possibly didn't show up as chickenpox on your bodies, but you were exposed to it, and you have the antibodies in your body. So either way, it's in your system. And again, the point that we learned today in the presentation is once it's inside you, it can reawaken. It's there now.
Yes, and that will be for life. because the reason why is that it hides, it's really a very good virus because it hides in an area where it cannot be touched by our own immune system. It's in the nerve, yes.
All right, so now let's go proactive. You're saying prevention. How can we avoid it then, Dr. Solante?
Of course, there are now preventive measures, and as an infectious disease, I would go directly that there are vaccines available for this, no? And that's why we're so happy that with vaccines available, there is now we can offer to our patients that possibility of getting this infection, suffering from those what we have heard from most patients, especially the pain. Karen, I'm so glad that you really emphasize that, no? Because when we talk about shingles in the clinic, we don't talk about you will die of shingles because they will always, no, will I die? No, it's the pain. Alam mo, pag sasabihin mo yun sa pasyente, yung pain, then you describe the pain. I have pictures in my laptop and I show them, talagang, ganun pala yung shingles? And then actual patients, yung nakikita nila, so horrible for them. And that's why they don't want to suffer again shingles. Parang ganun ang impact.
But what about like diet, sleep? Of course, all those are part of the factor. No.
Yes, because anything that is not normal for you, even yung tinatawag natin na normal amount of sleeping hours, okay, 7-8 hours a day. If you do that like less than 7 hours, 5 hours in a week time,
We're both
then you're also high risk for that, no? Because that will also lessen your immune response to some of this. So stress is one powerful driver for the reactivation. Even if you're less than 50 years old, you can have that, no? As what some of our patients are experiencing now. Wala silang mga comorbidities, wala silang, tapos magtataka sila, Dok, bakit ganito ang nangyari shingles? I thought it's about an immune system malfunction or dysfunction. We go, what's your work? Call center. I work in the ganito. So that's the reason why you have that.
So here's the thing, a lot of people actually don't think they'll get shingles. 49% think that they are unlikely to acquire shingles. But after hearing the stories from Doc na, call center agent, you're not getting enough sleep and all these, anyone, we're really at the point that anyone can get it. But as Karen was saying, it's just something we can be aware of and deal with. And that's why, Karen, you actually have a documentary.
No, so what we are doing an information, it's not, documentary is too long, but an information awareness packet, right? That for people to understand what it is. And ako personally, when you ask what should be done, I personally vaccination is quite controversial. We know that, right? But ako specifically, I had myself vaccinated already against shingles because and you have to do it twice. So that's the thing. It's not a one-time vaccination. There's a period, Doc, no? Is it after 6 months first and then?
Within 6 months.
Within 6 months. So the first thing I did after finding out that I had shingles twice and then meeting someone who had shingles thrice. Four times is I immediately had myself vaccinated. But I think you should consult your doctor when it comes to that, if you need it, if you should do it. So at the end of the day, it's
your prerogative.
Yes,
it's your choice.
It's really speaking with your doctor.
So that you can make an informed decision. And I like that you're doing this information packet, because we should continue this conversation. Net thoughts on that, continuing the conversation, continuing this advocacy to awareness.
Nagpapakuna ka na ba? Oh my gosh!
Sorry, nasabi na ako sa pain.
Oh my God, don't live with that. Don't live with that. Don't do that to yourself.
But definitely discussing this with your doctor is very important. And I think you mentioned this, Isa, kanina, yung mga Pilipino kasi hindi nag-share. My mom also had shingles and I didn't know until I saw that she was bent over in pain. Sabi ko, paano nangyari sa'yo?
Within your own family members.
And she
I
wouldn't
hope
talk kasi
it's-
tinitiis. I think the elders, titiisin nila, ay, painkiller naman ako, kaya ko pa, ganyan. And it was when I took her to the doctor, tsaka lang namin nalaman na it was shingles. And I think aside from going to a doctor, it's also sharing all the information that you can, especially I think at my age, my body's going through all these things. If ever there's anything new that I feel, ay ikukwento ko kay Doc yan. Wala akong pakialam kung dal ako ng dal kay Doc. The more information I share, the better. I want to share this because pinagalitan ako ng doktor ko kasi to help numb the pain, I would sleep with an ice pack on my breast. And it was bad. My doctor told me, bakit? Why are you doing that? It worsens the condition because you're making your muscles harder. Lalo mong sinastress yung muscles mo. And you shouldn't do that because it affects the nerves.
Don't self-medicate,
Exactly, because
go
no.
to a doctor. Consult with a
Diba?
doctor.
Hindi nga ako nag-Dr. Google, naman ako self-medicate.
Dr. Ice. Dr. Ice.
So yun. So, talk to your doctor and give all the information that you can.
And thank you for your valuable insights. And again,